Well, the U.S. has injected, as we heard, trillions into its economy as it fights the coronavirus. But the businessman-in-chief decided to make savings elsewhere. President Donald Trump halted funding to the World Health Organization, accusing the agency of failing to stop the spread by being too trusting of China. His decision has been widely criticized. The UN body plays a central role in trying to stop the outbreak. One public health professor said it was a case of the U.S. cutting off its nose to spite its face. But does Trump have a point? Has the WHO made mistakes in its handling of the pandemic? We'll discuss that in a moment. But first, Adam Pletz has this report.
I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus.
US President Donald Trump says swifter action by the WHO would have saved thousands of lives and avoided an economic meltdown. He has accused the organization of pandering to China and accepting its much-questioned death toll at face value. But Trump had himself heaped praise on China, tweeting in January that the US greatly appreciated Beijing's efforts and transparency. The Democrats have consistently accused the president of trivializing the virus.
You know, Donald Trump downplayed the seriousness of this crisis for weeks, and he continues to delay the mobilization of the national resources to deliver life-saving equipment for our doctors, our nurses, our frontline workers. And as a result, this virus will hit all of us harder than it otherwise might have hit us. And it's going to take us longer to recover.
In February, Trump suggested the virus would disappear like a miracle. But the US is now the worst affected country, with around a third of the world's cases. And critics say the president is using the WHO as a scapegoat to deflect from his handling of the crisis. The US makes the single largest contribution to the WHO, having paid almost $900 million in the last 2 years. The EU and many individual countries have condemned Washington's unilateral suspension of funding. But the WHO has recognized that in due course its performance should be reviewed. And past reviews have highlighted major failings, such as during the 2014 Ebola outbreak in West Africa. But it says now is a time to unite against a common enemy.
We regret the decision of the President of the United States to order a halt in funding to the World Health Organization. With support from the people and government of the United States, WHO works to improve the health of many of the world's poorest and most vulnerable people.
And it's those people who are likely to feel the impact of any US funding cuts, often living in places where the WHO conducts invaluable work in the prevention of diseases like malaria, tuberculosis, and AIDS. Even if Trump has valid criticisms, many say he is acting for the wrong reasons at the wrong time. So is the US president more concerned with saving face than saving lives? Or is he prompting a much-needed review of a failing organization? Adam Pletz, The Newsmakers.
Well, as you saw there from Adam's report, the U.S. has paid almost $900 million to the World Health Organization in the last 2 years. So how will cutting that funding affect the UN body? To help answer that, we're joined by Drew Harris. He's a population health analyst at Thomas Jefferson University. And Dave Harden is the managing director of the Georgetown Strategy Group. He was a USAID official working with the World Health Organization during the cholera outbreak in Yemen. Gentlemen, good to have you back on the Newsmakers. So, Drew Harris, Trump halting funding to the World Health Organization in a time of a global pandemic. Is it as bad as it sounds?
I'm afraid it is. It really says more about the president and his political reality than it does about the World Health Organization. He's dealing with severe domestic political issues here and real concerns about where the blame is going to be placed for the lack of an effective response here in the United States. So he's casting about, and as you said in your report, he's looking for a scapegoat. And the World Health Organization, because of all of his inherent flaws, because of how it's constructed, makes a very likely and useful target for his
Right.
ire.
So, Dave Harden, at worst, when we look at the World Health Organization's relationship with China and its response and reaction in the early days of COVID-19, like in January, for example, maybe at best it was incompetence, at worst a cover-up and some sort of collusion. I hate to use that word collusion when I'm talking about Trump, but a collusion with China, right? Does Trump have a point, even though what he's doing is probably really bad?
So, Imran, thanks for having me back on again. It's very tough. I would first hearken to Donald Rumsfeld, of all people, right? You go to war with the army you have, not the army you wish you had. And WHO is the institutional entity that allows us to focus and to address the pandemic that is in front of us. Now, WHO needs to do much better, and they need to do much better now going forward. But they are our only institution that we need to continue to fight this pandemic.
Right. Dave, I remember not too long ago, I watched a clip on Twitter, I think, or on YouTube, of this World Health Organization official being interviewed by a Hong Kong TV channel. And then he hung up when he was asked about Taiwan. And he was like, sorry, I can't hear you. And then he hung up. And then they called him back and they asked him about Taiwan again. And he said, we've already spoken about China. With that sort of behavior, it doesn't help itself, does it? Because it sort of makes it seem as if it's in the pockets of Beijing.
Right. I mean, I agree. That was a terrible interview, and it was a terrible example of WHO being politicized. Now, it is tough in the sense that WHO does have to work with member states, and it's just an entity that's funded by member states, and so they have a very difficult balance in terms of all the political interests that are at play here. But that's the reality in which they're given. And that example of the interview in Canada was an example of them failing to figure out how to manage this crisis. Let me make one other quick point. So we have the kind of technical capabilities that require data analytics and broader policy questions. And then you have the WHO activities on the ground. These are distinct activities. And I am in particular disappointed with their inability to move fast, to provide data analytics, to provide results, and to create efficiency. So there are plenty of ways in which the WHO needs to do better, faster, more now.
Drew Harris, they're not going to get any more efficient or better now that they're hundreds of millions of dollars poorer, right?
No, it's sort of the old joke about the beatings will continue until morale improves. So let's just starve them and see if they're going to function more effectively. I mean, the reality of the World Health Organization that it has significant responsibility, but not a whole lot of authority based on this member structure. I mean, so that's just the reality of many of these multilateral organizations. I also think that there's a larger issue going on here in terms of U.S. Politics. It seems to be almost a deliberate effort to attack these organizations that are governmental, that we trust to do and respond effectively to disasters like COVID-19. And that trust is being eroded one agency, one entity at a time. And that, unfortunately, is bleeding out into this current attack on the World Health Organization. And if people do not have trust in these institutions, then they're not going to listen. They're not going to respond. They're not going to believe that we can overcome this. And that's a recipe for really chaos.
And I wonder, Dave Harden, what do you think about that? Does it become a kind of self-fulfilling prophecy from Trump, I guess, similar to the Iran nuclear deal, right? He pulls out, then Iran says, go get stuffed, and we're going to enrich uranium. And Trump turns to everybody and says, you see, I told you we can't trust them. So with the World Health Organization, maybe they'll get closer to China now, right? Because they need money, don't they?
So I'm not entirely convinced. So let me walk through a couple of quick things. First of all, in the United States, Trump is the responsibility for where we are right now. I mean, it's nobody else's fault. It's not WHO. It's not China. At the end of the day, we have 41,000 dead right now, and 22 million that have applied for unemployment. Buck stops with him. So, kind of any diversion and criticism that relates to WHO isn't legitimate as it relates to his performance. As it relates to WHO's performance, and again, I'm not a supporter of this administration at all, but are there seeds of elements in this that are true? And the answer to that is yes. The WHO, first of all, this is not a permanent ending of funding to WHO. It's a limited halt and review. Now, hopefully, the administration will go forward. Who knows? But the WHO bureaucracy and results can be improved in and of itself, and must be improved in and of itself during a time of crisis. I mean, adept organizations require agility to respond almost on a daily basis to adjust and kind of respond.
Dave, a limited halt and review of 60 to 90 days in the middle of a global pandemic, right? I mean, timing,
right? It's true. I mean, yes, you're right. You're right. I mean, it is ridiculous that what he's doing. Don't get me wrong. I think it's a ridiculous thing to stop WHO funding right at this point. So no doubt about that. But the question is, can we get WHO to do better right now and adjust both on the data analytics and the response capabilities? And the answer is yes. And they have to be open and self-aware and reflective enough to figure out how you make that happen.
I appreciate that perspective. Drew Harris, so WHO involved in not only informing us about what's going on with COVID-19 around the world, they're involved in also trying to coordinate and help look for treatment, coordinate and help look for vaccines. Also involved in, as we heard in Adam's report preceding this discussion, fighting measles and cholera in Yemen. Dave was working on that as well, right? They've just sort of turned the corner in conquering Ebola in Western Central Africa. Is all of that good work going to be harmed? Is it clear to you that it's going to be harmed?
Well, I think that if we begin to believe that the World Health Organization can't function at all, that it's not going to be effective, and that we just have to throw it out and start from scratch with something new, then I think that's a really bad idea. I think we need to identify where the flaws were. And believe me, it's not just the World Organization. Every country in our response to this has to look within itself and say, what could we have done better? I mean, we knew that there was going to be a pandemic. It wasn't a matter of if, it was a matter of when. All the signs were there, all the plans were there. And so many of these plans weren't fully implemented, and we were so slow in responding that we really missed opportunities to make this thing a lot worse than it currently is. So all the institutions, every government has to look within itself and figure out what could have been done differently, including the World Health Organization, of course.
Dave Harden, without turning to China for more money, how do other member states get more involved now? There's clearly a vacuum of sorts to the tune of hundreds of millions of dollars. $400 million was given by the US to the WHO last year. How does it make that adjustment in the short term and the medium term in order to remain efficient? Which member states step up?
Okay, first of all, let's deal with the reality we have right now, which is the budget shortfall. So the WHO must drill down right now and be more innovative, go out with basically some small limited funding that would drive some innovation solutions in terms of contact tracing, particularly in fragile states and vulnerable populations in the Middle East and Africa. They could work very aggressively to bring in higher levels of technical talent on the data analytics from major universities and major talents around the world. All of this almost costs nothing. They could work with the UN structures to create some kind of humanitarian pause in the most complicated conflicts that are out there right now, which again costs zero. And I think if they just simply stepped up their game to drive better results, then money would come, whether it's from the US or Europe or elsewhere. And again, the United States can't outsource its responsibility to WHO, and the United States and the Trump administration is responsible for the failures in America right now. There will be a second wave. And WHO will be the lead responder to that wave, and they just need to be much more aggressive, even if they have limited resources, in tamping down those risks.
Okay, lots of challenges ahead for all of us, including the World Health Organization, which is significantly poorer, at least for the next 60 to 90 days, while it's under review from the Trump administration. Dave Harden and Drew Harris, I've got to move on. We're out of time. But as always, it's been a pleasure talking to you here on the Newsmakers. Thanks for joining us, gentlemen.